And to Sierra Leone now, where the Cuban medical brigade is already working, treating those infected with Ebola. After a thorough training, they begin their work. The team is working in a hospital with 100 beds, one of the largest situated in the western rural district of Carytown.
It is an example of how a well-equipped hospital that meets present needs can be built in a few weeks. Carytown is currently concerned with how to protect those that work within its walls. It was built by the British military and is administered by Save the Children, but the majority of the doctors and nurses providing care are Cuban.
This is good. We can work here. The conditions are in place. And well, we are all here fighting to save the lives of our brothers.
All of the tasks and practices that we have been taught, first the theoretical ones in Cuba and the practices here, have been in place, and we have lost the fear with regard to our work, and we are developing well. Of course, taking care of ourselves and taking all the necessary.
The beginning has been very acceptable. We've had many patients and 3 have been discharged, and there is another that will be discharged this afternoon or tomorrow morning.
They work wearing the PPE uniforms up to an hour, because they cannot tolerate any more than but with regular shift. They make sure the patients are accompanied by doctors and nurses 24 hours a day.
That protocol was established in a debate we have had between the organizations and ourselves.
The Cuban doctors and nurses work with 50 English-speaking doctors that have come with Save the Children, such as the Irish epidemiologist Carrie Garavan, who has said the Cuban doctors are marvelous. The hospital only has 7 patients. Save the Children has put in place a test week before filling the 100 beds, while in other public hospitals the sick and dead pile up. Meanwhile, here, at the hands of the Cubans, patients receive the necessary treatment for all the illnesses caused by Ebola.
We've seen things that have moved us, but despite everything, we are in good spirits in terms of health and emotionally as well. We are going to continue moving forward. We are going to give everything we can over the next 6 months.
Over the next few weeks, the rest of 165 Cuban medical professionals will go to various hospitals to learn and end, once and for all, this Ebola nightmare. From Freetown, Oscar Epelde for Telesur.